The appendicular skeleton includes all of the limb bones, plus the bones that unite each limb with the axial skeleton. The bones that attach each upper limb to the axial skeleton form the pectoral girdle. This consists of two bones, the scapula and the clavicle. The clavicle or collarbone is an S-shaped bone located on the anterior side of the shoulder. It is attached on its medial end to the sternum of the thoracic cage. The lateral end of the clavicle articulates or joins with the scapula just above the shoulder joint. The scapula or shoulder blade lies on the posterior aspect of the shoulder. It is supported by the clavicle and articulates with the humerus to form the shoulder joint. The scapula is a flat, triangular-shaped bone with a prominent ridge running across its posterior surface. This ridge extends out laterally where it forms the bony tip of the shoulder and joins with the lateral end of the clavicle. The clavicle of each pectoral girdle is anchored to the axial skeleton by a single, highly mobile joint. This allows for the extensive mobility of the entire pectoral girdle, which in turn enhances movements of the shoulder and upper limb. The clavicle has three regions: the medial end, the lateral end, and the shaft. The medial end, known as the sternal end of the clavicle, has a triangular shape and articulates with the manubrium portion of the sternum. This forms the Sternoclavicular Joint, which is the only bony articulation between the pectoral girdle of the upper limb and the axial skeleton. This joint allows considerable mobility, enabling the clavicle and scapula to move upward and downward and anteriorly and posteriorly during shoulder movements. The lateral or acromial end of the clavicle articulates with the Acromion Process of the scapula. This is the portion of the scapula that forms the bony tip of the shoulder. The scapula plays an important role in anchoring the upper limb to the body. The scapula has several important landmarks. The three margins or borders of the scapula are named for their positions within the body. These are the superior border of the scapula, the medial border of the scapula, and the lateral border of the scapula. The suprascapular notch is located lateral to the midpoint of the superior border. The corners of the triangular scapula at either end of the medial border are the superior angle of the scapula and the inferior angle of the scapula. The inferior angle of the scapula is the most inferior portion of the scapula and is particularly important because it serves as attachment points for several powerful muscles involved in shoulder and upper limb movements. The remaining corner of the scapula, between the superior and lateral borders, is the location of the glenoid cavity or glenoid fossa. This shallow depression articulates with the humerus bone of the arm to form the glenohumeral joint. The small bony bumps located immediately above and below the glenoid cavity are the supraglenoid tubercle and the infraglenoid tubercle. These provide attachments for the muscles of the arm. The scapula also has two prominent projections. One is the hook-like coracoid process. At the shoulder joint, the coracoid process is located inferior to the lateral end of the clavicle. It is anchored to the clavicle by a strong ligament and serves as attachment sites for muscles of the anterior chest and arm. On the posterior aspect, the spine of the scapula is a long prominent ridge that runs across the upper portion. Extending laterally from the spine is a flattened and expanded region called the acromial process. The acromion or acromial process forms the bony tip of the superior shoulder region and articulates with the lateral end of the clavicle, forming Acromioclavicular Joint. Together, the clavicle, acromion, and spine of the scapula form a V-shaped bony line that provides attachment sites for the neck and back muscles acting on the shoulder, as well as muscles that pass across the shoulder joint and act on the arm. The scapula has three depressions, each of which is called a fossa. Two of these are found on the posterior scapula, above and below the scapular spine. Superior to the spine is the narrow Supraspinous Fossa, and inferior to the spine is the broad Infraspinous Fossa. The deep anterior surface of the scapula forms the broad subscapular fossa. All of these fossae provide large surface areas for the attachment of muscles that cross the shoulder joint and act on the humerus. There are 30 bones in each upper limb. The humerus is the single bone of the upper arm, and the ulna and radius are the paired bones of the forearm. The base of the hand contains 8 bones called the carpal bones, and the palm of the hand is formed by 5 bones called the metacarpal bones. The fingers and thumb contain a total of 14 bones, each of which is a phalanx bone of the hand. The humerus is the single bone of the upper arm region. At its proximal end is the head of the humerus. The head articulates with the glenoid cavity of the scapula to form the glenohumeral joint. The margin of smooth area of the head is the anatomical neck of the humerus. Located on the lateral side of the proximal humerus is an expanded bony area called the greater tubercle. The smaller, lesser tubercle of the humerus is found on the anterior aspect of the humerus. Both the greater and lesser tubercles serve as attachment sites for muscles that act across the shoulder. Passing between the greater and lesser tubercles is the narrow intertubercular groove, or sulcus, which is also known as the bicipital groove because it provides passage for a tendon of the biceps brachii muscle. The surgical neck is located at the base of the expanded proximal end of the humerus, where it joins with the narrow shaft of the humerus. The surgical neck is a common site of arm fractures. The deltoid tuberosity is a roughened V-shaped region located on the lateral side in the middle of the humeral shaft. As its name indicates, it is the site of attachment for the deltoid muscle. Distally, the humerus becomes flattened. The prominent bony projection on the medial side is the medial epicondyle of the humerus. The much smaller lateral epicondyle of the humerus is found on the lateral distal side. The roughened ridge of the bone above the lateral epicondyle is the lateral supracondylar ridge. All of these areas are attachment points for muscles that act on the forearm, wrist, and hand. The powerful grasping muscles of the anterior forearm arise from the medial epicondyle, which is thus larger and more robust than the lateral epicondyle. That gives rise to the weaker posterior forearm muscles. The distal end of the humerus has 2 articulation areas, which join the ulna and radius bones of the forearm to form the elbow joint. The more medial of these areas is called the trochlea. The trochlea articulates with the ulna bone. Immediately lateral to the trochlea is the capitulum, which is a knob-like structure located on the anterior surface of the distal humerus. The capitulum articulates with the radius of the forearm. Just above these bony areas are 2 small depressions. These spaces accommodate the forearm bones when the elbow is fully bent or flexed. Superior to the trochlea is the coronoid fossa, which receives the coronoid process of the ulna, and above the capitulum is the radial fossa, which receives the head of the radius when the elbow is flexed. Similarly, the posterior humerus has the olecranon fossa, which is a larger depression that receives the olecranon process of the ulna when the arm is fully extended. The ulna is the medial bone of the forearm. The proximal end of the ulna resembles a crescent shape with the C-shaped trochlear notch. This region articulates with the trochlea of the humerus as part of the elbow joint. The inferior margin of the trochlear notch is formed by a prominent lip of bone called the coronoid process of the ulna. Just below this is a roughened area called the ulnar tuberosity. To the lateral side is a small smooth area called the radial notch of the ulna. This area is the site of articulation between the proximal radius and the ulna, forming the proximal radial ulnar joint. The posterior and superior portions of the proximal ulna make up the olecranon process, which forms the bony tip of the elbow. More distal is the shaft of the ulna. The lateral side of the shaft forms a ridge called the interosseous border of the ulna. This is the line of attachment for the interosseous membrane of the forearm. The interosseous membrane of the forearm is a sheet of dense connective tissue that unites the ulna and radius bones. The small rounded area that forms the distal end is the head of the ulna. Projecting from the posterior side of the ulnar head is the styloid process of the ulna, which is a short bony projection. This serves as an attachment point for a connective tissue structure that unites the distal ends of the ulna and radius. In the anatomical position, with the elbow fully extended and the palms facing forward, the arm and forearm do not form a straight line. Instead, the forearm deviates laterally by about 5 to 15 degrees from the line of the arm. This deviation is called the carrying angle. The carrying angle allows the forearm and hand to swing freely or to carry an object without hitting the hip. The carrying angle is larger in females to accommodate the wider pelvis. The radius runs parallel to the ulna on the lateral side of the forearm. The head of the radius is a disc-shaped structure that forms the proximal end. The small depression on the surface of the head articulates with the capitulum of the humerus as part of the elbow joint, whereas the smooth outer margin of the head articulates with the radial notch of the ulna at the proximal radioulnar joint. The neck of the radius is a narrowed region immediately below the expanded head. Inferior to this point, on the medial side, is the radial tuberosity, which is an oval-shaped bony protuberance that serves as muscle attachment points. The shaft of the radius is slightly curved and has a small ridge along its medial side. This ridge forms the interosseous border of the radius, which is the line of attachment for the interosseous membrane that unites the two forearm bones. The distal end of the radius has a smooth surface for articulation with two carpal bones to form the radiocarpal joint. On the medial side of the distal radius is the ulnar notch of the radius. This shallow depression articulates with the head of the ulna, which together form the distal radioulnar joint. The lateral end of the radius has a pointed projection called the styloid process of the radius. This provides attachment for ligaments that support the lateral side of the wrist joint. Compared to the styloid process of the ulna, the styloid process of the radius projects more distally, thereby limiting the range of movement for lateral deviations of the hand at the wrist joint. The pelvic girdle or hip girdle is formed by a single bone, the hip bone or coxal bone, which serves as an attachment point for each lower limb. Each hip bone, in turn, is firmly joined to the axial skeleton via its attachment to the sacrum of the vertebral column. The bony pelvis is the entire structure formed by the two hip bones, the sacrum and coccyx. Unlike the bones of the pectoral girdle, which are highly mobile to enhance the range of upper limb movements, the bones of the pelvis are strongly united to one another, forming a largely immobile, weight-bearing structure. The hip bone or coxal bone forms the pelvic girdle portion of the pelvis. Each adult hip bone is formed by 3 separate bones that fuse together during the late teenage years. These bony components are the ilium, the ischium, and the pubis. The ilium is a fan-like superior region that forms the largest part of the hip bone. It is firmly united to the sacrum at the largely immobile sacroiliac joint. The ischium forms the posterior-inferior region of each hip bone. This supports the weight of the body when sitting. The pubis forms the anterior portion of the hip bone. The pubis curves medially, where it joins to the pubis of the opposite hip bone at a specialized joint called the pubic symphysis. When you place your hands on your waist, you can feel the arching superior margin of the ilium along your waistline. This curved superior margin of the ilium is called the iliac crest. The rounded anterior termination of the iliac crest is the anterior superior iliac spine. Inferior to the anterior superior iliac spine is a rounded protuberance called the anterior inferior iliac spine the iliac crest curves downward to terminate as the posterior superior iliac spine. More inferiorly is the posterior inferior iliac spine. This is located at the inferior edge of a large roughened area called the auricular surface of the ilium. The auricular surface articulates with the auricular surface of the sacrum, forming the sacroiliac joint. The shallow depression located on the anteromedial or internal surface of the upper ilium is called the iliac fossa. The inferior margin of this space is formed by the arcuate line of the ilium. This is a ridge formed by the pronounced change in curvature between the upper and lower portions of the ilium. The large inverted U-shaped indentation located on the posterior margin of the lower ilium is called the greater sciatic notch. The ischium forms the posterolateral portion of the hip joint. The large roughened area of the inferior ischium is the ischial tuberosity. The slightly curved posterior margin of the ischium above the ischial tuberosity is the lesser sciatic notch. The bony projection separating the lesser sciatic notch and greater sciatic notch is the ischial spine. The pubis forms the anterior portion of the hip bone. The enlarged medial portion of the pubis is the pubic body. Located superiorly on the pubic body is a small bump called the pubic tubercle. The superior pubic ramus is the segment of bone that passes laterally from the pubic body to join the ilium. The narrow ridge running along the superior margin of the superior pubic ramus is the pectineal line of the pubis. The pubic body is joined to the pubic body of the opposite hip bone by the pubic symphysis. Extending downward and laterally from the body is the inferior pubic ramus. The pubic arch is the bony structure formed by the pubic symphysis and the bodies and inferior pubic ramus of the adjacent pubic bones. The inferior pubic ramus extends downward to join the ischial ramus. Together, these form a single ischiopubic ramus, which extends from the pubic body to the ischial tuberosity. The pelvis consists of 4 bones: the right and left hip bones, the sacrum, and the coccyx. When standing in the anatomical position, the pelvis is tilted anteriorly, and the anterior or internal surface of the sacrum faces forward and downward. The 3 areas of each hip bone, the ilium, the pubis, and the ischium, converge centrally, forming a deep cup-shaped cavity called the acetabellum. This is located on the lateral side of the hip bone and is part of the hip joint. The large opening in the antero-inferior hip bone between the ischium and pubis is the obturator foramen. Several ligaments unite the bones of the pelvis. The space enclosed by the bony pelvis is divided into 2 regions. The broad superior region, defined laterally by the large fan-like portion of the upper hip bone, is called the greater pelvis. The greater pelvis is also known as the greater pelvic cavity or the false pelvis. This broad area is occupied by portions of the small and large intestines, and because it is more closely associated with the abdominal cavity, it is sometimes referred to as the false pelvis. More inferiorly, the narrow rounded space of the lesser pelvis, also called the lesser pelvic cavity or the true pelvis, contains the bladder and other pelvic organs, and thus is also known as the true pelvis. The pelvic brim, also known as the pelvic inlet, forms the superior margin of the lesser pelvis, separating it from the greater pelvis. The inferior limit of the lesser pelvic cavity is called the pelvic outlet. The differences between the adult male and adult female pelvis are related to the function of the body and body size. Because the female pelvis is adapted for childbirth, it is wider than the male pelvis. This can be seen by the distance between the anterior superior iliac spines. The ischial tuberosities of females are also further apart, which increases the size of the pelvic outlet. The female sacrum is wider, shorter, and less curved. and the sacral promontory projects less into the pelvic cavity. This gives the female pelvic inlet, or pelvic brim, a more rounded or oval shape as compared to males. The lesser pelvic cavity of females is also wider and more shallow. Because of the obvious differences between female and male hip bones, this is one bone of the body that allows for the most accurate sex determination. Like the upper limb, the lower limb is divided into 3 regions. The thigh is the portion of the lower limb located between the hip joint and the knee joint. The leg is specifically the region between the knee joint and the ankle joint. Distal to the ankle is the foot. The lower limb contains 30 bones. These are the femur, the patella, the tibia, the fibula, the tarsal bones, the metatarsal bones, and the phalanges. The femur is the single bone of the thigh. The patella is the kneecap and articulates with the distal femur. The tibia is the larger, weight-bearing bone located on the medial side of the leg, and the fibula is the thin bone of the lateral leg. The bones of the foot are divided into 3 groups. The posterior portion of the foot is formed by a group of 7 bones, each of which is known as a tarsal bone, whereas the midfoot contains 5 elongated bones, each of which is called a metatarsal bone. The toes contain 14 small bones, each of which is a phalanx bone of the foot. The femur, or thigh bone, is the single bone of the thigh region. It is the longest and strongest bone of the body and accounts for approximately 1/4 of a person's total height. The rounded proximal end is the head of the femur. The head of the femur articulates with the acetabellum of the hip bone to form the hip joint. The fovea capitis is a minor indentation located on the medial side of the femoral head. The narrower region behind the head is called the neck of the femur. This is a common area for fractures of the femur. The greater trochanter is the large upward bony projection located above the base of the neck. The lesser trochanter is a small bony prominence that lies on the medial aspect of the femur just below the neck. Running between the greater and lesser trochanters on the anterior side of the femur is the roughened intertrochanteric line. The trochanters are also connected on the posterior side of the femur by the large intertrochanteric crest. The elongated shaft of the femur has a slight anterior bow or curvature. At its proximal end, the posterior shaft has the gluteal tuberosity, which is a roughened area extending inferiorly from the greater trochanter. The gluteal tuberosity becomes continuous with the linea aspera. The linea aspera is the roughened ridge that passes distally along the posterior side of the mid-femur. Multiple muscles of the hip and thigh regions make long, thin attachments to the femur along the linea aspera. The distal end of the femur has the medial and lateral bony expansions, called the lateral and medial condyles of the femur. The lateral and medial condyles articulate with the tibia to form the knee joint. The roughened area on the outer lateral side of the condyle is the lateral epicondyle of the femur, and the irregular outer medial side contains the medial epicondyle of the femur. Posteriorly, the medial and lateral condyles are separated by a deep depression called the intercondylar fossa. Anteriorly, the smooth surfaces of the condyles join together to form a wide groove called the patellar surface. The patellar surface provides for articulation with the patella bone. The patella, or kneecap, is the largest sesamoid bone of the body. A sesamoid bone is a bone that is incorporated into the tendon of a muscle, where that tendon crosses a joint. The patella is found in the tendon of the quadriceps femoris muscle. The patella articulates with the patellar surface of the femur, and thus prevents rubbing of the muscle tendon against the distal femur directly. The patella also lifts the tendon away from the knee joint, which increases the leverage power of the quadriceps femoris muscle as it crosses the knee. The patella does not articulate with the tibia. The tibia is the main weight-bearing bone of the lower leg, and it is the second longest bone of the body after the femur. The proximal end of the tibia is greatly expanded. The two sides of this expansion form the medial condyle and the lateral condyle. The top surface of each condyle is smooth and flattened. These areas articulate with the medial and lateral condyles of the femur to form the knee joint. Between the articulating surfaces of the tibial condyles is the intercondylar eminence. The tibial tuberosity is an elevated area on the anterior side of the tibia near its proximal end. A small ridge running down the lateral side of the tibia is the interosseous border of the tibia. Located on the posterior side of the tibia is the soleal line. The large expansion found on the medial side of the distal tibia is the medial malleolus. This forms the large bony bump found on the medial side of the ankle region. Both the smooth surface on the inside of the medial malleolus and the smooth area at the distal end of the tibia articulate with the talus bone of the foot as part of the ankle joint. On the lateral side of the distal tibia is a wide groove called the fibular notch. This area articulates with the distal end of the fibula, forming the distal tibiofibular joint. The fibula is a slender bone located on the lateral side of the leg. The fibula does not bear weight. Instead, it serves as a primary point of muscle attachments. The head of the fibula is a small knob-like structure located at the proximal end. This articulates with the inferior aspect of the lateral tibial condyle, forming the proximal tibiofibular joint. The thin shaft of the fibula has the interosseous border of the fibula. The distal end of the fibula forms the lateral malleolus, which forms the easily palpated bony bump on the lateral side of the ankle. The posterior half of the foot is formed by 7 tarsal bones. The most superior bone is the talus. This has a relatively square-shaped upper surface that articulates with the tibia and fibula to form the ankle joint. The calcaneus is the largest bone of the foot, which forms the heel. The anterior half of the foot is formed by the 5 metatarsal bones. The toes contain a total of 14 phalanx bones or phalanges, arranged in a similar manner as the phalanges of the fingers. The toes are numbered 1 through 5, starting with the big toe or hallux. The big toe has 2 phalanx bones, the proximal and distal phalanges. The remaining toes all have proximal, middle, and distal phalanges. Thank you for watching.